Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by Ignite DDS Coaching, empowering dentists to build self-determined futures. Together, we're shaping the next generation of leaders in dentistry. Happy New Year, Dental Fuel listeners, and welcome back to Season 3. We're so excited to bring new guests this season with new mistakes and lessons along the way. Kicking off Season 3, we have Loren King, an accomplished dental hygienist who has made her mark by working in various states across the United States. Loren has practiced as a travel hygienist in 7 states due to her multiple licenses. Apart from her clinical practice, Loren is a dynamic speaker and educator. She has a passion and dives into significant topics like human trafficking awareness, airway health, and the human experience in dentistry. In this first episode, Loren talks about her unique journey in the world of dentistry and beyond. She talks about her life, career, and travels. And of course, we dive into a clinical mistake. Let's listen in. Loren King, welcome to Dental Fuel. How you doing today?
I am doing better than I deserve. That's what I will say. Better than I deserve. So really well. Thank you for having me.
Thanks so much for being here with me today. I'm so excited to hear about your story in life and for our listeners to hear about it as well too and get to know you a little bit more. But Loren, where are you coming to us from today?
I'm currently based in San Diego. I moved here back in January.
Very cool. Are you a California native?
I'm not. So I've actually lived in 8 states in the last 10 years.
Wow. Okay.
So I've moved around quite a bit, but luckily being a dental hygienist, I'm licensed in 7 states at this point. And so it's pretty easy to move around like that. But I'm originally from Memphis, Tennessee.
Oh, very good. Okay, cool.
Yes.
And Loren, tell me a little bit about what you're doing practice-wise right now.
So I'm primarily speaking as of now globally, but also I am still practicing clinically here and there as I guess what you would call now a travel hygienist in one of the 7 states that I'm licensed in. I'm not licensed here in California yet, so I'm having to go to other states to practice, but I'm doing that. And then, of course, teaching as well. And I actually just launched a life coaching business. So
congratulations to you.
Thank you. It's my little baby right now. It's only 3 weeks old. So, but it's honestly the one job I would do for free. It's incredible. I love it.
That's awesome. That's wonderful to hear. And Loren, tell me a little bit about some of the courses that you teach.
I'm primarily booked for human trafficking awareness in the dental industry and also airway health. And neither one of them have anything to do with each other. I like to say that because people always look at me like, wait, what?
Yeah.
Other than other than they're both issues that are killing millions of people every day. So
absolutely, and very important for us in the profession.
Yes, both of them. And then, of course, I teach a relative dental hygiene, productivity, and education course, essentially teaching hygienists how to talk to their patients, how to treat the patient as they should, the highest standard of care. But also, I felt like in school, nobody teaches you how to have a hard conversation with their patient. They just don't.
Very true.
And I remember asking a group of hygienists one day I was talking to, there was probably 150 people in the room, and one person raised their hand and said that they felt comfortable having a hard conversation with their patient about disease. And so for me,
astounding.
It's like we're not prepared. So I teach that, and then I am now delving more into outside of the dental industry and speaking about what I call the human experience, which is the one thing that we all share, no matter what we look like, no matter what the inside is like. It's if you strip us all down, that's what all of us share in common. So some deep stuff.
Yeah, that is really deep, but wonderful things that you're talking about it, and I'm so happy that you're passionate about it, and they are important topics. And Loren, just to shift a little bit before we get into the nitty gritty here, I was reading through your bio and I read that you enjoy skydiving and have done several skydiving adventures. Tell us more.
Yes. So I will say I am retired and I have jumped solo 34 times. I used to have my license. It's not active anymore. You have to keep up with like your recurrency and all of that stuff. And the reason I am retired at 34 jumps is because I almost impaled myself into a barbed wire fence in Hawaii. And the reasoning, I was like, I know my limits, and I think that was a limit. I think I'm done.
That's so scary.
It was terrifying. And the reason it happened is because in skydiving, you have a parachute over your head, of course, and that parachute and the wind and everything determines how quickly or not quickly you burn altitude. And so I was on too big of a parachute, and due to the wind and everything from the ocean, I could not burn altitude like what I'm used to. I fall pretty fast is what I'm used to. So I technically overshot, I guess you could say, my landing and literally landed right in front of the fence. So
You have solidified my decision never to do that.
Listen, it's one of the safest sports that there is, and it is a sport, but any skydiver will tell you if someone gets hurt in skydiving, it's the skydiver's fault.
I have heard this.
Yes, it is one of the safest sports that there is. So don't let my stupidity of not advocating for myself. And I knew that the wing loading of the parachute was not what it should have been, but I was a new skydiver. I didn't want to overstep my bounds with my coach and all of these things. So it's like, well, he knows what he's doing more than I do. I haven't jumped here before, but no, you have to advocate for yourself, right? You have to. Your life depends on it sometimes.
It's so important. What an important message in skydiving and in life, advocating for yourself.
Yes, 100%.
Well, Loren, let's dive into it. Here at Dental Fuel, we are dedicated to learning from each other's mistakes and sharing mistakes so that way we can grow together and, just grow as individuals in the profession of dentistry and grow as a whole. But to kick us off, I would love to know about a clinical mistake that you have remembered making and how that has impacted the way that you practice now.
So when I was starting out in my career as a dental hygienist, I'm going on 7 years now. And, I feel like in the beginning, like we were just saying, you're scared to have those hard conversations, and you're scared that you're going to overstep. Even though we are the provider, we should be advocating for our patients. A lot of times, especially with new hygienists, you don't have the confidence to overstep a doctor, to be honest, and advocate for your patient and say, no, doc, respectfully, this isn't enough. We need to do X, Y, and Z for the patient. It takes a lot to overstep your boss like that, and it is overstepping. So I had a patient that was not a healthy patient, bleeding everywhere. We had enough time to do SRP, but the doctor did not want to do it. They were scared that they were going to lose the patient and that the patient wouldn't pay for treatment, and then we wouldn't get anything out of it. We wouldn't get any production out of it, right? And so I just did the prophy. And then 3 months later, this patient comes back and she sits in my chair and she's crying. And I look at her and I was like, what's going on? And she told me, she was like, I just broke up with my boyfriend, or really my boyfriend just broke up with me because my mouth has been bleeding. And I just looked at her and immediately everything sank, because that was my fault. I didn't advocate for her. I knew she wasn't healthy. I knew she needed SRP. And me being timid and no one in school teaching me how to overstep or how to respectfully advocate for your patient, I let it go. And that day I did the SRP. The doctor and I did kind of get into it, and I advocated for my patient. But the mistake was I didn't do it the first time, and it caused her emotional trauma along the way. And I think a lot of times we forget that the things that we don't do for our patients, while it might take a while for us to see that it actually hurt them in the long run, it does eventually hurt them. So we have to keep the mentality of, yes, we're usually dealing with chronic disease. It's something that's happened slowly over time, but it doesn't mean that the impact is any less. It just takes longer for it to happen.
What a powerful message, again, in the importance of advocating for yourself. And I think that can be challenging for, new grads, whether it's, in dentistry, as a dentist, as a dental hygienist, or even a seasoned person in a new setting, knowing how to speak to that, more seasoned doctor or that established doctor in a practice, and having those tough conversations. Those tough conversations are important for the sake of our patients sometimes. And so, yeah, that's challenging. I'm sorry that you were put into that situation, and sorry to hear about your patient as well too. But I bet she was better off after you did that SRP.
Yes, she was. And it's just I had to do what I had to do, and at that point it taught me a lot. You can lose your job. I mean, I've been in practices before where I've advocated for the patient. Now, I'm definitely very serious about it. Even down to airway, I'll be in a practice and I'll advocate for the patient and say, "Hey doc, I don't know if you guys are implementing airway or not, but they need to be referred." And I said they have, X, Y, and Z going on. It's usually screaming a problem. And I've been asked to leave before. I've been asked to leave the practice as a temp because I overstepped. And I get it, I do. But at the same time, I'm like, with something as serious as breathing versus not breathing, respectfully, I'm advocating for my patient, even if you ask me to leave. So you learn a lot in those really tough situations.
Definitely some periods of growth for sure. And being asked to leave, that's very strong. Ready to take the next step in your journey? Book an intro call with Ignite DDS Coaching today and level up your future in dentistry. Thanks for tuning in to our first episode of 2025. We're so excited to continue our conversation with Loren King, as well as future conversations with future guests. Join us next week when we talk about a financial mistake.